This portion of Local Lifestyles is sponsored by Owensboro Health.
And welcome back to Local Lifestyles. Well, we're talking today about structural heart services at Owensboro Health, and we have interventional cardiologist Dr. Ashish Rastogi here with us this morning. Thank you so much for coming by. We're glad to have you here because this is an important topic, and there are a lot of treatments that we want to talk about too. But let's start with what is structural heart disease, and is it different than some other heart conditions?
Yeah, so structural heart disease is kind of what it sounds like. I like to compare the heart to a house when I tell it to my patients. A house has plumbing. Just like that, the heart has arteries that can get clogged up that can cause heart attacks in the future. A house has electricity that can need a pacemaker for the heart if there's electricity issues for the heart in the future. And then the heart has a structure. It has walls, it has doors, and just like that, the heart has its own walls between the chambers, and the doors are called valves. And so issues with these valves or issues with holes in the heart need to be treated, and that's the field of structural cardiology.
Some people probably could be born with this, and it could also develop over time? Yeah,
a lot of the hole issues that are in the heart can develop, or people are born with typically, and the valve issues typically are developed over time.
Okay, and one of the most common, I was kind of reading through a lot of the information that you sent us, aortic stenosis. So let's talk about that one. Sure,
it's one of the more common things that I treat. It's a problem with the aortic valve. That's the door that connects the heart to the aorta that delivers blood to our whole body. Over time, this valve can get blocked up, called stenosis. It can be mild and eventually can become severe. It's actually very common. 1 out of 8 people over 70 have at least a mildly blocked up aortic valve.
But there's a procedure to treat this.
Yeah, so previously we only had the option of doing open heart surgery, which is cutting the chest open, a major operation. Nowadays there's a procedure called the TAVR. It stands for a transcatheter aortic valve replacement. Minimally invasive, small incision in the groin, replace the heart valve within about an hour.
That's amazing.
Up and walking the same day, home the next day.
So the advancements with the treatments just continue to be amazing and just so much better for the patient. How would someone know, what symptoms would they have? How would they maybe know that they have this?
Yeah, so aortic stenosis typically would cause symptoms of shortness of breath, fatigue, lightheadedness, dizziness, chest pains. You might develop swelling in the legs or what we call heart failure symptoms. Those are the more common ones. A lot of people just oftentimes confuse it with just, I'm getting older, this is how it feels when you're 85 years old, and really it's the valve getting blocked up.
So not necessarily. So I mean, if you're experiencing those things and you think, oh, I just don't want to whine or whatever, but you should talk to your doctor about these things and see if there's something like you could do.
Definitely.
Because these procedures may not be all that, like you said, invasive as to what you might think. What other procedures kind of do you offer?
Yeah, so the aortic valve, do the TAVR. For the mitral valve, it can get leaky. There's a procedure called the mitral clip. Similar procedure where you just put a little clip on the valve and make it less leaky. There's a procedure called the Watchman procedure. People who have atrial fibrillation need to be on blood thinners to minimize stroke risk. They can have bleeding issues on blood thinners. This is an alternative to come off blood thinners completely. I also close holes in the heart, PFOs, ASDs. There are some minor things that I do, but those are the major 3.
And what kinds of patients are kind of maybe eligible to have these kinds of procedures done?
Yeah, so really any patient, from any age range. I have patients who are in their 50s, patients as old as their mid to late 90s who are eligible for it. And as long as you have symptoms that are explained by this valve issue or this heart issue, it should be an option for them.
And why is it so important? You know, like we were saying, if you have these symptoms, why is it so important to go and talk to your doctor and get some medical attention? What can it lead to?
Yeah, I mean, it's important to identify what's going on, because patients who have specifically aortic stenosis in particular, oftentimes when they have symptoms and it's severe blockage is developed, about 1 in 5 may not be still alive in the next 5 years. And so it can progress pretty fast and be the cause of issues for them in the future.
So it can extend your life, basically, what you guys are doing. Thank you, Dr. Rastogi, so much. We appreciate you coming in today a lot, and we'll be right back with more Local Lifestyles right after this.
This portion of Local Lifestyles is sponsored by Owensboro Health.